It is certainly safe to say, I would think, that most of us are getting up every morning and reading and watching the news. We're eager to hear about the COVID cases and how things are looking here in the Tennessee Valley. Of late, it appears that the number of cases are kind of holding steady. The concern seems to be right now those in the ICU and those numbers going up. But we're happy this morning to have Margaret Zylstra here. She joins us from the Hamilton County Health Department. She's an RN with them. Good to see you this morning.
Hi, thanks for having me.
So I know you wanted to focus a bit this morning in particular on this conversation of contact tracing. We're learning more and more in the course of these last several months, and some new vocabulary entering all of our households. What exactly is contact tracing, and is the health department the sole entity that handles it?
Well, contact tracing starts with contacting the person who tests positive and getting information from them about their potential exposures, where they have been. We really want to know potentially where they might have become exposed, and then we ask them to also give us a little bit of a history prior to them testing positive or developing symptoms, and that's to track down people that they might have been close to who may potentially be exposed and develop illness.
Are you at the health department, Margaret, are y'all the sole ones doing this though? If ever there is a case of COVID-19 in the area, are you notified, and then from there you take the helm to do this contact tracing?
We do. We are the lead agency on doing this. We do have other teams that we work with, but we coordinate with everybody that does any kind of contact tracing, and we do training if that's necessary. We have developed a pretty big team here at the health department, but then we work with staff at the state level, and we work with other teams locally as well.
So what is your talk internally, as much as you can reveal, with schools starting back? Each school in the viewing area is doing its best to come up with a plan that is safe for everybody, but are you watching closely? Are you expecting cases to increase?
Well, it's really hard to predict what, going forward, what's going to happen. But we have been in significant meetings with the school system in developing their plans. We have developed a very good communication plan about what the process will be if a case shows up in a school, and how we identify potential contacts in that setting, and what the follow-up will be. So we have a very good relationship with the school system in moving this forward. And we have added additional staff specifically to address the schools.
Can you walk me through a timeline if I give you a hypothetical? Because I think the average person out there is really interested in knowing how this all works from your vantage point. So let's say that it is, I'll take a wedding, that's an easy one, and that you find that somebody at a wedding has tested positive. Whenever that testing site gets the positive result back, they notify the health department. Is that how that works?
That is correct.
And
yes.
Then from there, what's your next step? Do you contact that particular patient and his or her family to begin to get the data collected, and how long does that typically take?
Yes, we always start with the case that's positive, and get as much information as we can. We do ask that person who's positive to notify people that they identify that they potentially have been in close contact with. So for example, at a big event like a wedding, we do ask them if they would please notify organizers or parties at the wedding that they have tested positive. That makes it easier for us then to identify contacts at that event, because they're already aware of why the health department might be getting in touch with them. This usually happens within a day or two of us getting this positive result.
Are there cases that you may know of where people are testing positive but they are still going to work?
That's a hard one to answer. Each case is different. Sometimes the person who tested positive is not aware that they're positive, so they may be at work when we get in touch with them. So, that's an immediate, as soon as they become aware, of course, they do leave work and isolate themselves from others.
And hasn't it changed, Margaret, the incubation period, if you will, the quarantine time? Is it still 14 days or are we working on a shorter timeline now?
No, the quarantine, which is for close contacts, has always been 14 days from exposure.
Okay.
The case, the person who is positive, is isolated for a minimum of 10 days, and then it's dependent on whether within that 10 days they have recovered from their symptoms, or their isolation may be longer if they continue to have symptoms. So that's on a case-by-case basis. We make that determination with the person who tests positive.
Okay, I only have about 30 seconds or so left. So in that time, can you walk me through what the symptoms are for a person to say, you know what, I'm experiencing these, I should go get a test?
That certainly has grown bigger, but frequently people say, it started with a headache, a sore throat, some nasal congestion. I thought it was allergies. I thought it was a cold. And, once those continue past, the normal period, or they develop a fever and a cough with that, sometimes that's what triggers them to get tested.
And is the best thing, if they have any of those symptoms, to contact their primary care physician or go straight to a testing site to make an appointment?
They could do either one. I think a lot of primary care physicians can test, but the quickest way is just to go through a testing facility.
Well, Margaret, I could keep you here the full hour and ask you all kinds of questions because there are so many things we're learning, and I thank you for sharing the time you could with us today.
Well, you are very welcome.
You can learn more always by going to health.hamiltontn.org. They are here to service our area and all things related to health, but of course right now their primary focus is on COVID-19 right there on the front lines. Thanks again, Margaret.
You're welcome.
Hey, ho, everybody get up.